One of the worst pains there is shingles pain. And it comes up, one of the misconceptions about shingles pain is that it only affects older people. And so people like my dad, when he was 80, had shingles pain. But I've seen people as low as in their 20s that have had shingles pain. So it can affect people of all ages. It's usually comes as a herpes infection. So the medical name for shingles is herpes zoster. And it usually comes about when the immune system is weak. And these are five or so solutions that I've come across. One I've come across recently, but the others I've employed in our clinic and with colleagues and patients. So the first one I want to talk about is capsaicin or red pepper extract. And capsaicin is an approved treatment for nerve pain. Shingles pain is a nerve condition. And the nice thing is capsaicin or red pepper extract is found in every pharmacy in America and most health food stores as well. The next one I want to talk about is when my dad got shingles, the doctor gave him some lidocaine patches to apply to the shingles. And he reported that worked well. But for my dad, at the time when my dad was prescribed shingles, lidocaine was only available by prescription item. And my dad, red pepper was $10. Lidocaine patches by prescription were $150. My dad said, "I'll just take the red pepper." And but nowadays, lidocaine patches are available over the counter. And if you have really good insurance, like you're in a union or something, you could probably get a doctor to prescribe the lidocaine patches, and the prescription a little bit stronger. The next one is anti-inflammatories. So standard doctors recommend ibuprofen. Natural therapists recommend things like bromelain or curcuma. And just to confirm, curcuma is a concentrated extract of turmeric. Then the next thing I want to mention is herbs, acupuncture have a lot to offer. First of all, if you have shingles, they can administer herbs and acupuncture treatments to help alleviate the pain. But then another advantage is they can administrate other herbs to help prevent further outbreaks and to improve your immune system. And perhaps the greatest benefit of going to see an herbalist acupuncturist is there's a therapy called moxibustion, which basically involves burning herb over the acupuncture points. And it doesn't really burn the skin. It just warms the skin and uses this herb called Artemisia vulgaris. So moxa treatment has been shown in clinical studies in China to help reduce shingles outbreaks. Now, the final solution I came upon just very recently. I was researching laser treatments for shingles and regular herpes. And the author said, well, I always recommend laser and non-invasive therapies like vitamins and herbs and things. But once in a while, somebody's in terrible pain and I have to use a drug. And I recommend cimetidine. Cimetidine was introduced in the United States as a prescription allergy drug called Tagamet. It's been available in the United States for 30, 40 years. So it's available in every pharmacy in the United States. It may be known as the generic name was cimetidine, or it may be known as the trade name, which is Tagamet. The bottom line is that research done in Michigan and in Israel, and they've done clinical studies on this, suggests that cimetidine dramatically shortens the duration of herpes infections. And what I'm so excited about this is again, it's available, it's relatively cheap. It's available at every drugstore in America. You can just buy it and take it, obviously use it as directed. There's a specific dosage that they've used in clinical studies, and that dosage is 600 milligrams divided into 3 dosages. So 200 milligrams 3 times a day during the day, and then you take 400 milligrams at night. I believe most of the tablets in the United States are 200 milligrams. So in terms of the painful affected area, we do have 2 things, red pepper, and we do have the lidocaine patch. Those are both used topically. Now, if you go to see an acupuncturist herbalist, they may also be able to recommend some topical therapies. I used to recommend a topical therapy that had san chi, which is a specific type of ginseng, as well as a specific Chinese herb called dragon's blood. And I found that this combination, it was a combination of about 5 herbs, frankincense, myrrh, dragon's blood, and a few other things that would basically help the pain, but also help the outbreaks or vesicles heal more quickly. So those are some really good suggestions that you can apply. And one more thing I want to say about cimetidine Tagamet. This is not something your doctor, your pharmacist, or your nurse is ever going to be here about, but you can find this information on the web. This concludes our podcast for today. If you'd like to see more videos like this, please comment below and let us know what topics you'd like to hear about. And be sure to like and subscribe to help us grow our channel. If you'd like to know more about us, please visit our website at getwellfoundation.org.